Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 132,142 confirmed cases of COVID-19 in Canada and 43,161 cases in Ontario. Chatham-Kent has 363 cases and Sarnia-Lambton has reported 341 cases. Michigan now has 107,371 cases with 13,851 cases in Detroit. Today, we are reporting 2,556 cases of COVID-19, an increase of 5 new cases from yesterday. 1 is related to travel outside of North America, 3 are close contacts of confirmed cases, and 1 case is still under investigation. Overall, 26% of our cases are between the ages of 20 and 29 years, and 23% are between the ages of 30 and 39. 65% are male, and 35% are female. 2,398 cases are now resolved, and 83 cases are active and being followed by our health unit. 8 people are in the hospital, and 1 person is in ICU. Our community has lost 75 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are 2 retirement homes currently experiencing a COVID-19 outbreak. As well, there is 1 outbreak in the manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you're feeling confused or losing consciousness. There are several options to access an assessment and testing center in Windsor-Essex County. Erie Shores Healthcare in Leamington, Windsor Regional Hospital, Olat Campus, the Sportsplex at St. Clair College, and SOHAC in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test results. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you are unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. I hope you all had a restful and safe long weekend. Since Friday, the Windsor-Essex County Health Unit has reported 1 death of a resident in a retirement home and a total of 14 cases, including the 5 mentioned by Teresa today. I know that much of the community is working hard to prepare for reopening of schools, whether you're a parent, a student, teacher, bus driver, or other support staff. We heard this morning on the radio from our local police reminding parents and the community regarding road safety due to the increased traffic we always expect around this time of year. We've also heard from the Chief Medical Officer of Health for Canada, Dr. Teresa Tam, the importance of not becoming complacent and continuing to observe and practice physical distancing, hand washing, respiratory etiquette, and monitoring yourself for symptoms of COVID-19. I echo these sentiments to ensure a safer start to the school year. As we get ready to welcome thousands of children back in school over the next few weeks, I urge the public to continue to be mindful and practice all public health measures. Most importantly, watch for symptoms of COVID-19 and going to an assessment center for testing if needed. Please make sure if your children are showing any symptoms, please keep them at home and follow with your healthcare provider or public health for further directions. Last week, I discussed a community cluster that resulted in a high number of cases and close contact. A close contact is someone that has spent time in close proximity within 2 meters of a case for a long period of time. Members of the household or caregiver are usually identified as close contact of a confirmed case. When a case is identified, our team of public health nurses contact them to begin the process of contact tracing. This process is very important from a disease containment perspective. It is also important for our team to reach out to all the possible contacts of the case and interview them to identify if they were exposed and are at a high risk of developing the disease. High-risk close contacts are advised to self-isolate for 14 days from their exposure, monitor for their symptoms, and get tested. Since the last time I reported about this cluster, there's not many cases that we have identified according to this cluster. We will provide more additional information tomorrow in terms of the final count, but the numbers haven't changed much from what we reported. There's a lot of confusion regarding requirements for self-isolation, especially for those identified as close contact. Direction for isolation of close contact is always given by public health unit as part of our investigation and contact tracing process. After going through all the details of the potential exposure time period and the testing, and then the proximity of the close contacts. If you have not been identified or contacted by the health unit, you will likely not have been identified as a close contact of a confirmed case. If you believe you may have had an exposure to COVID-19, you should monitor for your symptoms, contact your healthcare provider, and visit an assessment center for testing. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with Windsor.
No questions at the moment, thanks.
Any questions from CBC?
No, thank you.
Any questions from AM 800?
Dr. Ahmed, back on August 14th, you talked about the importance of self-isolating if you're considered a high risk to a close contact. Since that time, how has everything gone with advising those individuals to self-isolate if they've been in close contact with someone?
So this is an educational opportunity that we have to go through at all times. Our nurses provide that information with very specific details of what it means for self-isolation. If you're living with other family members, how you can self-isolate yourself within your family. And if you have been identified as a close contact of a confirmed case and you live alone, what are your obligations in terms of going outdoor, going for any activities at all? So all those detailed instructions are provided by it. There are often times that we get into more discussion with the individual, and as mentioned, there were some instances where we felt that there's a need for clarity in language and clear direction, and we have issued Section 22 order on those individuals who violated any of those isolation orders. So it's an ongoing work, and the community, as I said, majority of them, almost all of them, follow all our recommendations. There are always instances where we like to provide that education, make sure that they are keeping themselves safe, and failure to do that have resulted in the issuance of Section 22 order against them.
Since that time, how many orders have been issued?
I don't have a number, but I think I would say at least from August 14th to now, I want to say at least 3 or 4 Section 22 orders that we have issued.
Sorry, one more quick one here. I guess prior to the 14th, were any orders issued, or is it just education at that time?
No, there were other orders issued as well. So I think we have issued a number of Section 22 orders, and that resulted in compliance and clarity in terms of what the expectation is. It has been a process right from the beginning of this pandemic, which we have issued with caution, and it always resulted in just more on the education and clarity of expectation.
Okay, thank you.
Any questions from Blackburn?
Have you added any more to that community cluster? I think last time it was 31 cases. Have any more cases been added to that cluster?
We did, and I'll provide an epi summary tomorrow, but we did not a lot. I think I want to say at least 3 or 4 cases we have added into that cluster. we'll provide that information tomorrow. We wanted to just make sure that we pool all that information that we have collected over the weekend before we report it. So tomorrow we'll provide that epi summary.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, doctor. I think you've answered this question before, but just wanted to confirm, if there is a case among a student or a teacher or somebody at a school, is the health unit going to make that information public so that we can get the word out to the community that they may have been exposed?
So there are some specific communication protocol that has been provided to us by the ministry in terms of how the communication will flow. There will be some communication flowing from the health unit to the school, and then the school will be sharing that information to the rest of the community. Our focus would be more on the case and contact management, but any kind of communication would be coming in from the school, and they will be getting information from us as per protocol that was laid down by the ministry.
Okay, so the school boards are going to be responsible for letting us know if they've had a case in that then?
Okay, Mark, can you? So I'll let Teresa answer that question.
Well, we're working with all of the school boards right now regarding the communication plan, but the school boards do have a responsibility to keep up their website as well. So information will be on their website, and we'll probably link to their website. But we're working on all of those specific scenarios and communication pathways right now.
Okay, basically we just want to make sure that media isn't left in the dark and nobody actually finds out when there is a case. So I just want to confirm that there are plans in place to make that information, what can be made public, put it out there.
Yes, that's accurate.
Thank you.
Okay, any further questions from Windsorite?
Yesterday on the health unit's COVID data page, it said that there was one resident case for Rosewood, Erie Glen. Now it says 0 and it says 1 staff. So I'm just guessing that was a mistake, but I just wanted to confirm.
Yeah, that was an error, and we fixed it immediately as soon as we were aware of it. I think it happened within half an hour of the time it was posted.
Okay, thank you.
Any further questions from CBC?
No, thank you, I'm good.
AM 800?
This question for Teresa. Teresa, how's everything going with your team, the bylaw or the enforcement officers out there? I'm just wondering, what are their hours like on the weekends? Are they out until like 2 a.m. to make sure proper physical distancing is taking place on patios and whatnot?
I don't believe they're out till 2 a.m, but we have them doing various inspections, and they were out on the weekend, and I was told that it was a relatively quiet weekend from the tobacco and vaping enforcement officer perspective, and that a certain event that was planned did not generate the numbers that were anticipated, so that's good news on our part. But overall, the weekend was fairly calm, is what I was told this morning.
When it comes to the reopening of schools later this week, does this put more added pressure on your team? Will they have to go to schools at all?
We are working with our school nurses, the added nursing complement to support the schools will require that the nurses do support the schools in person and, virtually, and to provide case and contact management. We're already working with the school boards. So it will put more, not pressure, but more processes and streamlining actual pathways to make sure that everything is covered as schools reopen, and that the communication is there, and that we continue to work with each and every school board to make sure that the schools are safe, and that the students and the teachers have the information they need as they go into school.
And sorry, one more, Dr. Ahmed, the case today that is travel related outside of North America, does the health unit have any details where this individual traveled to and how long they were gone for, and now that they're back, who has to self-isolate with them?
Yeah, we typically don't go down into that level of detail, especially in the media, but our team is in contact with them, and as per Quarantine Act, they have to they have to do the isolation anyways. And in any time if they develop any symptoms, they need to be tested, and that's how we get those information. As we know, most, especially outside of North America, but there are travel restrictions already in place, with very few individuals who are allowed to return to or come to Canada. Not everyone can come to Canada at this time. And every Canadian resident or permanent resident or citizens, they are allowed to come, with some exceptional to the visitors as well. So this is all tightly controlled, and it is expected that there will be some travelers who will come back with potentially contracted COVID. The idea is anyone who is traveling, I think the key piece of information is essential that they continue to quarantine and self-isolate for 14 days before they go to the public.
Thank you. Have a good day.
Thank you.
Any further questions from Blackburn?
You just mentioned about the school nurses. So have they all been hired now? Are they being deployed, or what's the situation with the school nurses?
So our health unit was allocated 19 additional nurses for the school-focused support. And we are in the process of hiring, but we will be redeploying nurses that are currently at our health unit and assigning a complement of schools per nurse. And also we are considering pairing up that school nurse with a case in contact investigator nurse, so that there's support for that complement of schools. So we're still just fine-tuning the logistics of everything, but all 19 nurses are not hired at this time, so we will need to redeploy and make sure that the adequate staffing is there to support the school reopening.
So what exactly will their role be within the school? You said each nurse will be assigned a bank of schools, say, and then what will their role be within the schools?
So the role will be pretty comprehensive around COVID support, mental health support, also the kind of liaison with the school principal regarding, COVID questions, scenarios, anything that is going on. If there is a case, it'll be very important that the school nurse and the principal are able to work together and deal with the communication piece, the flow to the parents and to the rest of the school, and also work with our case and contact management team here at the health unit regarding isolation protocols and making sure that those who need to be off school or absent from school are aware, both at the school level and at the parent level. And so a lot of coordination pieces right now, and making sure that the schools have the support they need as they bring back students, staff, and also able to answer questions from parents as well.
Thank you.
Any further questions from the Windsor Star?
No, thank you.
Thank you, everyone.
Thank you.